Welcome to the show. My name is Zaitun Ali and this is Health and Wellness. Thank you for tuning in and each and every Sunday from 6 p.m. to 7 p.m. So today's episode, I know you can see hapa na metameta. Kuna vile na metameta kidogo kwenye Brookside. So it is courtesy of Brookside Plus that we're talking about lactose intolerance as the topic. And as you can see, tuko na lactose free milk hapa. Brookside Plus lactose free milk, and you'll get to see how it is important, especially to those wenye nasemanga ushaisikia nasikianga mimi niko lactose intolerant. Nilijaribu kusema hivyo kumbe nimeambiwa mimi si lactose intolerant. But joining me in studio, George Omolo is a nutritionist. He's president of Kenyan Nutrition and Dietetics Student Association. What's it called? Kensa. Ebu isema tena.
So, Kenya Nutrition and Dietetics Students Association.
Okay,
Kensa.
that is Kensa.
Yes.
Karibu sana.
Asante sana.
We want to learn about what lactose intolerance is.
Yeah, thank you so much. This is a nice topic.
Yes.
Thank you for having me, and of course, thank you to our viewers at home.
Yes.
So, like you said, my name is George Omolo.
Umekuwa diplomatic.
Yeah.
Uko sure ni nutritionist?
Yeah, very diplomatic.
Kidogo nifikiri umeanza siasa hapa.
Okay. Yeah, so I mean, it's a privilege to talk about this topic and to be able to educate the public so that they can know what is lactose intolerance, and they need to know how to take care of themselves in case, they suffer this condition or they know somebody who's going through this condition.
Yes.
How to take care of themselves, know what to do. Yeah. Yes.
Karibu sana. And even before we go too far, as you can see, this milk, the lactose-free, Brookside Plus lactose-free milk, iko na so many uses. So as you're preparing to watch this show, unaweza tengeneza chai hapo kwanza kidogo, because you can use it for smoothies, you can use it for baking, you can also use it for milkshakes, na pia unaweza tengeneza chai nayo. So as we're continuing, we'll come to that, and unaona hampers pia. Nitawapatia number, and you can win 1 or 2 hampers hapa. Kuna yangu na yako.
Yeah.
So unajua lazima si tukwe selfish. Yangu na yako tumeka hii side. Kuna zingine mbili pale naona. So please remember the WhatsApp line is 0759434389. 0759434389. Talk to me. Niambie mbona nikupatie hii milk today. Yes, on the show. Continue, George.
Yes.
So,
I mean, to our viewers, since we are talking about lactose intolerance, it's good to educate them what this is.
Yes.
When you talk about lactose, this is one of the major sugars in milk. So lactose basically is one of the we call it a disaccharide in a more complex term. It's a sugar that is commonly found in mammalian milk, and it's very essential for infants because that is what they need for their nutrition in the early stages of their lives. So when you talk about intolerance now, this comes about when the body produces insufficient amount of lactase, which is the enzyme that now breaks down the lactose in sugar into absorbable forms, which in glucose and galactose. Okay. So when you lack that enzyme, that means then the lactose in your milk is not going to be digested or broken down. Then that's what you form the diarrhea, the crampings, the stomach pain, abdominal pain that comes as a result.
Oh, so those you're mentioning some of the symptoms.
Yes.
So how to identify you lactose intolerant?
Yes.
Okay, you can just elaborate more on the symptoms as well.
All right. So, the classic symptoms here is you can have abdominal pain, you can have rumbling of the stomach, you can also have diarrhea, which is actually very common.
Yeah.
You can have bloatedness you can be bloated because of too much gas. And these symptoms are related now to the undigested, sugar. Because what happens that if you have less lactose, which is the enzyme that digests lactase, which is the enzyme that digests lactose in milk, then you have large amounts of that lactase that's able to accumulate in the colon or the small intestine. The intestine. So when they accumulate, what they do, they draw water into the colon. So once they draw water in the colon, the lactase now goes through bacterial fermentation. That fermentation that leads to production of high amounts of hydrogen and carbon dioxide. So that's what causes the bloatedness and the gas and all those things, and even the diarrhea that comes as a result.
Okay.
And sometimes you find when you go for, when you have a bout of diarrhea, you can see some kind of fatty kind of diarrhea because there's also fatty acid that is released as a result. Yeah, so that's what causes those classical symptoms, the bloatedness, diarrhea, abdominal pain, and the rumbling of the stomach that comes as a result. And it happens very fast. within 30 to 2 hours, you can start feeling the effects of
Immediately after drinking.
So you start having this, these symptoms. Yeah.
Oh no. So as we are talking about now this lactose-free milk, Brookside Plus lactose-free milk, what does it have that enables those who are lactose intolerant to be able to take it?
Okay, so what it has, just like from the name lactose-free, so because somebody who has lactose intolerance, they mean they have the problem now with the lactose because they lack the lactase, which breaks down the lactose. So lactose-free, the lactose is not there. So they'll not have any problem.
Okay.
So they can take it with ease. They'll not have those classical symptoms that you experience as a result of lactose intolerance.
Okay.
So they'll have any issue at all. And I think one of the concerns maybe that may arise, someone may ask, what is the difference with the regular milk? I know maybe you wanted to ask that.
Definitely.
Yeah. So now, there's actually no difference between lactose-free milk and the regular milk, because all of them they all contain the essential nutrients, which is the calcium. They have protein, they have vitamin D, they have phosphorus, vitamin B12, and riboflavin, which are the major components of that milk. But it has an extra advantage because now it can be taken by everyone. Remember the other one, the regular milk cannot be taken by somebody who is suffering from lactose intolerance.
Yeah.
Lactose-free milk now can be taken by everyone, whether you are lactose intolerant or whether you're not. So all of you can take it.
How common is lactose? How common is this challenge? How do I put it? Because are there so many people who complain about being lactose intolerant, probably right here in Kenya? How common is it, such a condition?
Yeah, the condition actually is very common, very, very common, because, and to answer your question, maybe we can look at the different types of it.
Okay.
And one of the types is the primary type of lactose intolerance. And this happens, you see, lactase, which is the enzyme, is actually more common during the infant stage because milk is the only source of nutrition for a child.
Oh, yeah.
But once the child is weaned off, and you find when they're weaned off, then they take less of milk as they grow, even into the adulthood.
True.
So once that happens, then the intestine also produces less of the lactase because now there's less of the milk to digest. So you find some adults, because of that, they get into between the years of 2 to 12 years of age, then two groups emerge. We have a group that is lactose persistent, which means they're able to retain the lactase activity even through adulthood. So they will not have any lactose intolerance issue. Then you have those groups that now have what we call lactose non-persistence. So this group are the ones now who are affected by this, because then you find as they age, then the intestine also produces less lactase enzyme as they, as they grow, as they age. And this is common. The prevalence is actually more than 65% among the population. So it's a very common issue.
More than 65%.
More than 65%. But it's more common to agricultural communities. Communities who rely solely on farm produce. Because you find once in those communities, and in fact it has been, some studies suggest, the Luos, the Luyas and the Kikus, because they depend on the, farm produce. So you find after the infancy stage, when, they have been weaned off milk, then they shift to the other forms of, of nutrition apart from dairy, dairy. And as a result, you find they, they then become lactose non-persistent because the lactose now reduces.
Okay.
So that's why the prevalence of lactose intolerance among the agricultural community is more than 65%. But then if you look at the pastoralist communities, it's different. The story is quite different. Because them, historically, from 7,000 years and back, they have been dependent on dairy products.
Yeah.
So you find them, they are lactase persistent. So even as they grow by, they're able to carry that to their adulthood. So they're not really affected. So to that community, the pastoralist, major the Maasai, the Turkana and Samburus, you find the prevalence is less than 15%. The agricultural community, the guys living in the urban centers, the coastal area, the prevalence is very, very, very high. So it's a big problem.
Okay.
It's a big problem.
And when we're talking about lactose intolerance, so what's the difference between that and now just having kawaida milk allergy?
All right. There's actually a big difference between the two. Lactose intolerance, just like we discussed, it's more of a digestive issue.
Oh,
it's a digestive issue where, you're producing insufficient amount of lactase enzyme to be able to digest, the sugar in your milk. Now, milk allergy is quite different. It's an immune reaction. When your body reacts to the protein in the milk. So your body reacts to the protein in the milk, and majorly we call it casein. So when your body reacts to that protein in the milk, then you start developing, you can have skin rashes. Sometimes it's even life-threatening. You can actually even die because of it.
Milk allergy.
Yeah, milk allergy.
Oh, no.
We have some people who have a very serious milk allergy. You could start having, respiratory depression, constrictions. It's very fatal. So it's quite different. One is immune-mediated. The other one is just a GIT issue.
Okay.
Yeah.
That makes sense. And when we're talking about my lactose intolerance, kindly explain to us, why is it more rampant in adults than in children? You come to discover it more, especially when you're grown up. Okay.
In children, just like I said, you find, when a child is born and they are solely dependent on milk, because the milk is the only source of nutrition. So their body is actively producing lactase enzyme to be able to digest, the sugar in that milk. So that's why it's not common in children. But we have a type of lactose intolerance which is common in children. We call it secondary. That can come as a result of disease when your gut is damaged. When you have, there are certain diseases that may expose a child or even an adult to, but that is temporarily. It's reversible. Once treated, then you're back to normal. But it affects adults mostly, like I said, is that once a child is weaned off milk, and then they transform to other forms of nutrition, so the body tends to produce less lactase as a person ages. As you grow older, then the lactase amount also decreases. So that's why it's much prevalent in adults as compared to children. Yeah.
And you've mentioned about the symptoms, but how do we test? How do we diagnose it?
There are different forms of testing. Okay, but first I'll address it from a nutrition point of view.
Yes.
Because you see, when you receive a client who comes to you and probably they suspect they're having lactose intolerance, I will not really be fast to send them for diagnostic test. First of all, probably what I'll call for is clinical assessment, their food. So what we do sometimes, we call for a food diary. Food diary simply means we sit with the client down, then they tell us the kind of food they take from morning, lunch to dinner for about 2 weeks or even a month. So they can, note it down what they've taken for the past month.
Okay.
So they note everything down. So once everything's well noted, then we sit down and try to see what are the sources of lactose in their foods. Is it the milk they're taking every morning? Is it maybe in the drugs they're taking, because there are some drugs that have lactose? Or is it, so we have to check and really be able to eliminate that their food probably is the source, or their food is not the source.
Okay.
Now, sometimes you find clients or patients who are not able to remember what they took last night or what they took the previous week. So for those ones, then you are forced to send them for some diagnostic test. And one of the gold standard is what we call the hydrogen breath test. This is the gold standard. It's most preferred because if you look at the one, when we talked about how it manifests, we talked about the bloatedness and the gases that comes as a classical symptoms of lactose intolerance. And that is because of the bacterial fermentation of the undigested sugar. So there's too much of that gas, the hydrogen and carbon dioxide. So when you go for the hydrogen breath test, it's able to detect the amounts of hydrogen. If it's too high, then definitely we know you have a large amount of lactose which is not digestible.
Those two ni kizungumkuti, lactose.
Yes.
Na lazima utaje hizi vitu kila saa, zina jina nyingine.
Hakuna jina nyingine, lazima utaje. So that's one of the tests. It's the gold standard, but in case you go to a facility that does not offer that test, there's another alternative, which is called lactase tolerance test. So this one, what you do, you give the patient lactose to take. You give them 50 grams or maybe 50.
So now this one is lactose free?
This is lactose free.
Oh, si tunapeana.
Sasa unajua na tunataka kumtest ujue kama kuna hiyo shida.
Okay.
So we want to test.
Lazima umpendi ujue.
Yes, so kuna ile, so hii test ya pili tunakupea lactose. Lactose tunakupea.
Okay.
Maybe 50 gram or 100 gram utumie. So once you take it, then we do a blood sugar test. Remember, like in sukari too.
Yeah.
So once you take it, then we do a blood sugar test. So in case we do the test in about 3 hours or less, na blood glucose level yako has not risen more than 20 milligram per deciliter, then it indicates there's a problem, which means the sugar has not been digested.
Okay.
And that means lactase yako iko chini ama haiko. So that will tell us definitely you are suffering from lactose intolerance.
Okay.
Yeah.
And there's lactose intolerance, and there's me on this other side who, some of us, we just don't like milk. How can we go back to saying yes to milk again?
Actually, you need to actually I know sometimes milk is good, right?
But
it's very good. And some of the good sources of nutrients. I mean, it will give you calcium,
yes,
vitamin D, phosphorus, and all these things. But if you're having an issue, like for the case guys who are suffering from lactose intolerance, then there are other sources that you can take to be able
yogurt.
You can take yogurt. Fermented yogurt is very good.
Okay.
It will be able to give you the calcium, the vitamin D, the phosphorus, the proteins. That will disappear, because if you don't take milk, then you'll be deficient of this calcium, vitamin D. I know that's a problem. You start having osteoporosis, or you start having nerve issues. So you need to take. So in case you cannot take milk, then you need to take at least substances that can give you the calcium, vitamin D, phosphorus, and protein, and vitamin B12. Yeah.
Okay.
So alternatives ziko.
Yeah.
Fermented yogurt ambayo umesema.
Mimi mpaka uneketuka flavor kidogo, like probably the yogurts,
Hata flavor iko sawa inaweza wekwa.
Okay.
Unapewa tu yogurt ambayo iko flavored, you're good to go.
Yeah. You've mentioned about two types. I've learned about the primary, the secondary. So are there other types of lactose intolerance, and what do we need to know about that?
Yeah, the other types, actually there are two more types. There's one that is genetic. So there's one that we call...
They could get it from you.
Yeah. Yes, there's one that is called congenital.
Okay.
So congenital, this is a case where a child is born that lacks the enzyme completely.
Oh.
They don't have it completely.
Okay.
Yeah, so they're just born like, but it's rare. It's not common. It's very rare. Then we have developmental. Majorly affects kids who are born preterm. So when you're born preterm, then you have immature enzyme production. Yeah, so you will be unable to produce that enzyme. Yeah, so kids who are born preterm most of the time suffer from that. So immature enzyme production. So they may lack lactase as an enzyme. So
and for them, what do we do at that point? But at that time, so wanatumia breast milk, so they're okay.
They're okay, but
now growing up,
they'll suffer the primary.
Oh, the primary.
The primary, yeah.
Okay.
Yeah.
Hey, okay. So me, I thought actually it's just niko allergic, niko lactose intolerance, nikusema tu. Actually, it's a condition.
It's a condition.
And how do we? What is it? What brings it about? You've mentioned about now not being able to digest. Yeah. But can we prevent it in a way?
Yes.
Is it possible?
You can actually prevent it. First of all, there's no treatment, right?
Sasa,
there's no treatment.
Second part yangu ya show naongelea juu ya treatment. Sasa tuongelelea nini?
Ndio hizi ziko hapa.
Ungeniambia mapema. Ndio treatment.
Ziko hapa. Ziko hapa.
Are you serious?
You see, what do you manage the symptoms? To manage those symptoms, the diarrhea, the bloatedness, the abdominal pain. So you manage those symptoms.
So it can't end entirely.
Yeah, you manage the symptoms. But what we've seen, especially in the urban population, you see, for example, if you come from a community that is not dependent on milk or milk products, then you come to Nairobi where all these things are available. So you find you start taking them. So there's a way in which also your body tends to to conform and adapt. Yeah.
Okay.
Yeah. So your body can actually adapt when you consume it, continue consuming it. Shida now with that also, it may lead to persistent symptoms, which are one of the symptoms now is the diarrhea.
Oh,
so,
but
so when you take it and you've not been diagnosed, because some of the symptoms actually are similar to symptoms of some other conditions.
True.
So you can
misdiagnose it by
you can misdiagnose, go and do some over-the-counter medications, but you're having some issues. And see the problem now with that, if it's not diagnosed and you think it's something else, utakuwa na persistent diarrhea. Just imagine, every time unakunywa maziwa unaenda choo, but you will not know what is happening.
Okay.
Or you're having abdominal problems all the time. And the more you take it, the more also you lack calcium.
Yeah.
You lack, vitamin D. So you start having bone issues and all those kind of things. So it's good to get diagnosed.
And I'm getting to learn. This is not a disease. It is a condition.
It's a condition.
Mimi nilikuwa najua ni disease.
No, it's a condition. Yeah, that can be managed.
Yeah.
Yeah.
When you're talking about the tastes, unajua nutritional value has to be top of mind.
Yeah.
But again, the taste.
Yes.
Now, is this different to the normal milk that people wamezoea? Is it better? How can you nile taste yenye lazima uiadopt ama unaweza manage nayo?
Unaweza manage.
So hakuna kitu different.
Hakuna kitu different.
Okay.
Maziwa ni the same.
You take milk?
Yeah, I do.
You love it?
Yeah, I do. I love it.
Who recommended this to you?
Knowledge is power.
Oh.
So yeah, knowledge. Knowledge is power. So I had the knowledge.
Yeah.
And of course, at first I had it taste aje.
Exactly.
It taste aje.
Exactly.
Will my body accept it?
Yes.
Yeah. So, but when I took it, then the taste is the same. I didn't see any difference, and then I had to look. Sometimes, for nutritionists, there's what we call food labeling.
Yes.
So you take the product and look what's the content, what does it have. So when I look at the content and then you compare with the regular milk, and then you realize there's no difference.
It's better.
There's no the content is the same.
Okay.
There's no difference. But now uziria hii, I can the lactose free one, anyone can take it. Those who are having the issue, the condition, or those who don't have the condition.
Okay. And I want our viewers pale nyumbani mtuambie. The question that I'm asking you, have you ever seen this product anywhere in your local supermarkets, retail shops? Have you ever seen it? And if yes, who recommended it to you? 0759 434389. There's a hamper for you. Niambie. Because right now, I think leo ndio kwa siku yangu ya kwanza. Juu amenipatia itakuwa siku yangu ya kwanza kuionja. Mnipatie hapa na feedback next week. I'll try. The last time I drank milk, I think I was 10 years old.
So you've never drank milk?
10 actually.
You stopped taking milk? 10, okay. So
imagine, 12 years.
What do you supplement it with?
Yogurt.
Okay.
I love milkshakes as well.
Okay.
But milkshake unajua ni ile moja nimetoka nimeenda mahali kunywa kitu, I can drink milkshake. Yogurt ni and it's not I need to be intentional because I'll drink the yogurt because I've bought it for my son, not like me generally. And I suffered also calcium what's it called? I was using calcium tablets
yes.
when I was after I delivered because I started having such issues after delivery. So nikaambiwa lazima calcium ikuwe high. Pia omena nini nikaambiwa sijui food
yes.
But sasa hizo akisikwangi fan. And milk, so I need to learn. I don't know what will bring me back to milk. Probably this might be it, but I need to come back to it.
If probably you're having an issue with the regular one, then
yes.
I can see you have a choice here.
Okay.
Kuna choice hapa.
That is fine. So we've talked about the value of what it brings about. So what can you recommend, especially to those who are lactose intolerant? What can you recommend to them in terms of diet? So apart from the milk, what else can they consider?
Okay.
Yes. Okay. In terms of calcium, just like you're telling me right now.
All right. So we have foods which are non-dairy, but they are very rich in calcium and vitamin D. Examples can be the normal skuma wikis, the
skuma wiki na calcium.
Iko na calcium. Iko na calcium.
Si vitamins.
Iko na calcium pia na iko na vitamin D pia.
Okay.
Na omena pia ambayo umesema. Fatty, fish also is very good. So there are food that they can use.
Yeah.
But also they also supplement they can take.
Oh yeah.
We have they can be supplemented with calcium, vitamin D, just the way we've said, vitamin B12, phosphorus and such. But pia kuna probiotics they can also use.
Okay.
Yeah, probiotics they can also buy over the counter. And but kuna one that is called Lactobacillus acidophilus.
What is that?
Lactobacillus acidophilus. Very good probiotic.
Okay.
For people who have lactose intolerance. So they can use that.
Okay.
Yes.
Sasa hapo kwa treatment ndo nilibaki nikijiuliza. Sasa ni tu na hizo foods. That's the only thing.
Yes.
Okay.
Yeah.
So and you mentioned about genetics. But by genetics you ulimaanisha ni during birth that it happens congenitally, but like I can't pass it to my son if I'm lactose intolerant. Like can someone else in the family also have the same condition?
No, that depends now. You see, like I said, it depends. Are you from a pastoralist community? Most likely, if you're from a pastoralist community, you may not suffer lactose intolerance because
Okay.
genetically it's passed through your system. You guys are having lactase enzyme
Yeah.
so in you, but you are coming from, you know, non-pastoralist community. You may suffer lactose intolerance. It's like I said, genetically, so it can be passed through your generation.
It can.
Yeah, it can.
Hii naambiwa kuna mtu ashaanza kutusema hapa ablesiwe. Ebu tuone. Let me see. Hi, please bless me with that gift hamper. Since I started using Brookside products, probiotic yogurts, my ulcers healing process has been smooth and fast. I can't stop using that probiotic yogurt. I'm looking forward to using the milk. Be blessed. Yeah. So the other time we were talking about the probiotic yogurt, still for Brookside Plus.
Yeah.
But today, lot kwa lactose intolerance, lactose free pole milk, and we'll see if we can bless you with that. So it helps also with ulcers. You can talk about other conditions that it helps with. Yeah.
Yeah, it also helps with that. Yeah, it helps with a number of conditions.
Which are?
Yeah, so, you know, like we are talking about in this case, lactose intolerance.
Yes.
And especially for those who are having these diarrheas, the frequent diarrheas, it's very good. The probiotics are very good for that because it's able to restore your normal flora. You know, their intestinal flora, so you don't suffer a lot diarrhea bouts. Yeah.
Okay.
So it's very good.
So hata nikidiarrhea kawaida naweza tumia na itasaidia.
Yeah, itakusaidia.
Okay.
Yeah.
That makes sense. So and in what ways can we use it now that we are mentioning and put it in tea? So in what ways can we be able to consume it? Yes.
You can take it as it is. You can use it to cook tea.
Yeah.
You know, in cereals. You know, the way you make cereals, you add milk in it. You can use it for smoothies. Yeah. So you can use it. You see, all the ways in which you use your regular milk, the same way you can use this milk.
You can.
Yeah.
Okay.
There's nothing. Hata kupika, nothing changes.
So practical tips. Next time kama nutrition, tutakuja tufanye hapa kwa ground. Tuone how you do it.
Sure.
And you mentioned you're president of Kenya
Nutrition and Dietetic Students Association.
Sawa. We are going to talk about that.
Yes.
More of that when we are coming back from this short
yes.
commercial break. So stay tuned. This is Health and Wellness. We're coming right back.
Watching.
Yes, welcome back. Just remember, this is Health and Wellness, and the topic of discussion has been lactose intolerance. So, wewe unapenda maziwa ama upendi kama mimi? Do you have milk allergies? Do you know what lactose intolerance means? Yes, we've talked about lactose, and we still have Dr. George Omolo atawaelezea zaidi. He'll do a recap of part 1 of what we were talking about. And this is courtesy of Brookside Plus. We've been having, but Dr. George, George, last month, we were having the probiotic Brookside Plus probiotic yogurt. So clearly pia nimeambiwa wenye hatupendi maziwa kawaida tunaweza tumia hiyo. Now this time tuna highlight the lactose free Brookside Plus lactose free milk. Wale wote wenye mko lactose intolerant na ataeleza venye tuna break down lactose, please. Hiyo ni yake acha nitamwachia. But we have a solution for you. And the WhatsApp line, like I said, is 0759434389. I can see guys are texting. Okay, let's see. There's someone, hey please. Yes, hiyo tumesoma ya probiotics yenye alisema mpaka ulcers zimesaidiana. Kuna mwingine anasema hey KTN home, this is Mablance. Mbona unajiita Mablance kwanza? But ni sawa tu. One of your loyal viewers and listener currently following Health and Wellness closely. Karibu sana to this show, and we are happy that you tune in every single Sunday. Knowledge is power, he's saying that. And KTN home nyumbani kwa wote. Asante sana. Won't mind taking the gift home. Long time viewer, your dedication. Look forward to continuing to watch KTN TV. Uto ni loyal viewer, but utaki hata kupata nutritional benefits. Hiyo ndo tunangangana pia kusema. You also need to get that. Pia ukitazama Health and Wellness unajivinjari hapo kidogo na lactose free milk, Brookside Plus lactose free milk. So we've talked about the advantages. Please warudie tu tena, just tell them what lactose intolerance means again, even as they're catching up, for those who are joining us right now. Yeah.
All right.
And the importance, mbona wanataka hii hampa, waambie value yenye iko hapa kwa hii maziwa.
Sure.
Yeah.
Thank you once again for having me. So, lactose intolerance. Okay, we start from understanding what lactose is.
Yes.
So, lactose is a sugar that is found in milk. Okay, so when you talk about lactose intolerant, it means that sugar that is found in milk is not digested enough. So if it's not digested, then you find somebody, you will take your milk, but then, because the lactose is supposed to be digested into simple sugars of glucose and galactose. If you're not lactose intolerant, if you take your milk, the lactose in milk will be digested, broken down into glucose and galactose, so you'll not have any issues. But if you're lactose intolerant, that means you lack the enzyme lactase. So when you lack that enzyme, the lactose in your milk will not be broken down. So when it's not broken down, then you have an undigested lactose, which then moves into your colon. So when it moves into your colon, then it undergoes bacterial fermentation. So that fermentation causes production of hydrogen and carbon dioxide, which then causes the gases. That's why you feel bloated, you feel abdominal pain, you have bouts of diarrhea, and rumbling of the stomach. That sound that comes, and that sound also comes through because of that. Yeah, so those are the classical symptoms of lactose intolerance. So lactose intolerance, when you lack the lactase enzyme, then you will suffer lactose intolerance because your lactose in your milk will not be broken down.
Okay.
Yes.
Yes, and like we said, the symptoms can be misdiagnosed most of the time because ni kawaida mtu kusikia unarambu utasema si ninja. You can dismiss it. But if symptoms persist, what now do we do?
If symptoms persist, it's advisable that you see your doctor, you seek medical help, you see a physician to diagnose you further and to be able to rule out any other condition that may be. Yeah, but you should not sit with it at home because it can be something more fatal or serious. So it's not good to assume. If it persists, then you seek further medical attention.
And if you're lactose intolerant, by the way, can you take any other milk products without going through the same symptoms?
If you're lactose intolerant, it means you will have problems with all dairy products.
With all
dairy products. In fact,
so it's just not milk.
Yes, in fact, including even processed foods.
Processed food?
Yes. Yes. So it's all milk products with cereals, fermented products. We are talking about bread, processed foods. And all day we are talking about cheese, milk. Anything that is dairy.
Serious?
Yes, all milk products and processed foods.
That means hata tukipika keki tunapika na maziwa ama
Yes.
So they can also react to that.
Yeah. So in that case, if you're in that category, you've been diagnosed, then lactose-free milk
is the way to go.
Is the way to go. Even to make your cake.
Hey.
Yes.
Hiyo ni maisha ngumu.
Si ngumu.
Si ngumu?
Si ngumu.
Okay, sawa. And I'm being told you can get them in the retail stores. You can have them in 1 liter. They come in 1 liter. And also we have the 500 ml. I'm sure mnaweza ona hapa. Hii ya kupika chai kila asubuhi nisianguke nikichukua lactose free. Kuna hii the 500 ml and you can also get it in 1 liter. Ndio hii hapa wameiona. Sawa. Hii hapa hata ndio tutapikia chai tusikie. Sisi hatujaikuwa lactose intolerance. Kwangu hakuna mtu mwenye ameshaikuwa lactose intolerance, but I'm also just willing to test that. Let me see. I can see also people are sending in. Sawa, zinakuja, wacha tuendelee. So someone was asking, how do I ensure that I'm getting enough calcium and vitamin D without dairy? So there's a conversation we were having here also before the break. And we were saying just even a glass of milk is enough.
Yes.
For you as an adult.
Yes, but again, you'll find some people may not really, they may have lactose intolerance, but they may not suffer severe symptoms as someone else. Because our tolerance level is different. Okay. We have somebody who needs to take up to 2 cups for them to suffer those, to have the symptoms. We have somebody who can take a cup to have the symptoms. So the tolerability level is different. But it also depends on the amount of the lactose you take. Yeah. Because again, if you don't take too much, you may not suffer the symptoms. So it also depends on the amount you're taking and your tolerability level. So we have those who cannot tolerate much. We have those who can tolerate. Yeah, but when you realize that you're not able to tolerate milk, then of course, just like you're saying, lactose-free milk is the way to go.
And that brings me even to another question. Can lactase be found, the enzymes, the one that we have here in this milk, can it be found in any other thing, like a supplement or something like that?
Yes, we have medications that have lactose. Because,
so iko na lactose ama ni lactase?
Lactose.
Lactose,
yeah.
Sorry.
Yeah.
So
because unapata medications, in the process of making medications,
yes.
we have what we call active ingredient, ile ambayo inafanya kazi.
Then
tuko na zile ambayo tunaita inactive ingredient. Zinawekwa hapo maybe to make that, if it's a tablet or capsule, to make it bulky.
Yes.
So lactose is used for that. Bath pills have lactose as an inactive ingredient, and so many other things. So you may find sometimes you may avoid all your dairy products, but then take medicine and you still have suffer lactose intolerance. Because
serious.
Yeah, you know, like you're saying, you've been diagnosed, ukapata shida ni you're lactose intolerant. Then you'll avoid all dairy and stick to your lactose free milk.
Yes.
But then also the medications you take, you need to look at the label and know what it contains. Most medications have lactose as an active ingredient. So you need also to check the medications you're taking. So if you suffer from lactose intolerance, so you need to be careful in your medication. Look at the content. So kama kuna lactose, tafuta ile ambayo haina.
Okay. Okay. So hata naona hapa mpaka kwa hotels, restaurants, at that level we also have the lactose intolerance milk. So it's something that is really common and people are actually taking keen note of. Mimi unajua hata ningepatia mtu na by mistake ukipatia mtu umebake keki na huko unajua kifaa nini hapo. So like what's the immediate remedy when someone is going through those symptoms? What's the immediate remedy?
The immediate remedy. Now, see, at this point, what we'll do is just try to manage the symptoms. Kama, if they'll be having diarrhea, you just get them antidiarrheal medicines to take.
But it can't prolong to a point that it's unmanageable.
No, it usually disappears. I mean, when the symptoms maybe may start within 30 to 2 hours, but also disappears also very fast. So it doesn't stay long. Yeah.
So, sorry. So, neza ignore niendelange kunywa maziwa.
Sasa shida ni ukiignore. Now you'll be lacking the calcium and the vitamin D and the proteins and the phosphorus, because remember that milk, the sugar in that milk is not being digested. Okay. So you lack the calcium. See, that's the problem.
So it's not helpful to your body.
So it's not even helpful to your body. So you'll be taking it, suffering all those symptoms, but at the same time you're not gaining nutritionally. Yeah. So that's why we are telling you, if you get these symptoms, get help. See a nutritionist for some clinical assessment, or go for some diagnostic test so that we confirm if at all actually you're having it or not. Okay. So that you find, alternatives, other sources of calcium, vitamin D, proteins and riboflavin and vitamin B12. Okay. It's quite deficient.
Hey, let me check. I can see. Hi, my name is Bansi, watching from Embu. God bless you for the wonderful teachings you always give in this show. It's my favorite. Oh, guy, karibu sana. This is what keeps us going. Yes. So just wondering what happens if I don't take milk at all. Am I at any risk? Aki, Bansi, you and me, same WhatsApp group, lakini wametupatia ma advice kidogo. You can just repeat it, Bansi aske.
Yeah. Milk is very important, all right, because it contains, large amounts of calcium and vitamin D, protein, vitamin B12, and phosphorus, which are very important, all right. Now, if you avoid milk completely, that means you'll be deficient of all these nutrients, the calcium, vitamin D, and when you lack calcium, vitamin D, and phosphorus, you may suffer osteoporosis in the long term, and you don't want to suffer that. You may start having bone issues, nerve issues as well, even cardiovascular issues you may suffer as a result. So that's why we are told, if you're not able to take milk, find alternative sources. Yes. Yeah, we have one source is taking lactose-free milk. Yes. Another source is taking plant-based milk. We have plant-based milk.
Yeah, ndio gani tena?
Almonds and the soyas.
Oh.
Yeah, you can still use them.
This is in plant-based milk. Yeah. Today I'm learning, you guys. Yes. Hey. Hey, okay. Okay.
Yeah. Lakini shida. Yes. People confuse milk allergy.
A lot.
Yeah. So somebody may be having an allergy towards milk and then they call it lactose intolerance. Yeah. That's again another problem.
But allergy umesema, okay, just differentiate kabisa. You've said allergy, it's more severe than...
It's more severe.
Lactose intolerance.
Yeah.
Yeah.
So milk allergy is immune mediated. Your body is fighting off the protein in the milk. So it's where you're allergic to the protein in milk. And that protein, usually, it's casein. We call it casein. So when your body reacts to that protein in that milk, then you may suffer symptoms like hives, where you have skin rashes, or you may have, severe symptoms like you can lose respiratory depression.
What is that exactly?
Depression, basically death. You can suffer death as a result. You have to stop pumping blood, you stop breathing, and even death can occur. So it's very fatal. Yeah.
Na allergies, like now for lactose intolerance you mentioned, lazima upatie mtu kidogo ndio ujue how they'll react. But now for allergy, how do you get to know? You just have to go through that.
Alafu unajua for allergy, you just have to avoid milk totally.
But how do we, when you come now, so before you know?
So that one is easy. When you take milk, unaanza kujikuna, or you start having swellings on your face, feeling uncomfortable, you feel like sweaty, feeling like you're not able to breathe, confusion. Especially every time you take milk and having those symptoms, then that is definitely milk allergy.
Okay.
Unajua kuna like for example cheese, the people when they take cheese or chocolate, wanafura kila mahali kwa uso. So now milk pia kwa hivyo. There are those when they take milk, they have swellings all over the face. Yeah.
Nuts, by the ziko mingi.
Yeah.
That I agree there so much. But I'm also being told that Brookside has the the almond. Omezita, the plant milks.
Plant-based milk.
Plant-based milks. Brookside Plus also has the same. The milk has it. Ikona pia soy.
Yeah.
That one. So it is also perfect. Can that work for the allergies?
Yes, it's actually perfect for those who are suffering from milk allergy.
Oh, really?
Yeah. So if you're having milk allergy, go to the plant-based
plant-based.
Yeah, plant-based milk.
So you need almond
soya.
And the soy sauce.
Yeah.
A good thing unaweza ipata. Wanaweza ipata pia kwa hiyo Brookside Plus. Yes, you can also get it in the Brookside Plus. Which milk? The kawaida lactose free? They can get it. Niko na mtu hapa ananipatia mwa Kenya. She's a very good representative hapa. Na anambia you asking about the soy. Yes. So soy almond.
Yes.
You can also get it and it's good for the milk allergy.
Milk allergy.
Sawa. Na umesema kabla tujue milk uko na hiyo allergy, how do you tread carefully?
Tread carefully because it can cause death. It's very fatal. So so anytime you take milk or any milk products, na uanze kujikuna, having swellings, feeling breathlessness.
Yes.
Then just stop it completely. Yeah.
Niko na mwingine hapa. Hi, I am Arnold. What is the line between animal milk, almond milk, soya milk, as far as lactose intolerance and milk preference is concerned? So clearly, ndio tulikuwa tunaongelelea hapa. Almond, soya milk, it's good for the allergies.
Yes.
Sindio?
Yeah.
So, but anauliza as far as lactose intolerance, the condition is concerned. So I ended to plant-based milk.
But anaweza tumia for plant-based milk. It's okay. If you're having lactose intolerance, even that's another choice you can use. Yeah. But it's more suitable for milk allergy.
For milk allergies. So thank you guys. I can see hey, text zenyu zinakuja kubaya. Hey KTN home, my name is Titus. I am from Nakuru. Hi Titus, how are you? I am a painter. Allah, sunichore. I do drink Brookside Milk Dairy since my job always demands milk for better healthy chest. I was introduced to Brookside Milk by my other workmate who is also a painter, and I can find it in any shop around my area. So clearly amepatana nayo. We hadi professions inafanya watu inahitajika wakunywe maziwa.
Maziwa muhimu. Calcium, bone health is very important.
Kama yeye painter inamwafectaje like the chest venye anasema, how does it now how valuable is it for him to take it?
I mean, because if you look at the benefits of calcium,
yes,
apart from the bone health, you also have nerve function. You need it for your nerves to function correctly. Yeah, you need calcium also for your cardiovascular health.
Yeah,
for your heart, for the heart to pump blood well, you need calcium.
Okay. Even
for blood clotting, you still need calcium. So calcium is very important for general health. So if you don't, take your milk, in case you have no problem taking, then there's a problem. So you need to take it. Yeah.
So. Hey, questions coming in. Good evening. Kindly ask the doctor to advise me on health. When I take milk, my stomach is bloating. Haya. Wewe shapewa daktari. Mbona nutritionist ampendangi kujiita madaktari?
Tunajiita.
Kwa nini lakini wengi sana, most of the nutritionists have been with them on the show, like there's no the doctor title, but ushapewa hapa na viewer
madaktari wa chakula walishe bora,
walishe bora. So we anauliza akigai na amekuwa kitu text pia. I can see you WhatsApp also last week about the dentist. Oh, sawa, tutakujibu hapo, tutakupatia namba ya dentist, tutamtafuta. But today as you're talking about the Brookside Plus, lactose intolerance, lactose free milk, he's asking, when I take my milk, my stomach is bloating. Please advise me.
Yes. Yeah. So, and that's one of the classical symptoms, because we talk about bloatedness. Na tulisema the bloatedness comes as a result when, when you take milk and it's not, the sugar is not broken down. So that lactose that is not broken down goes to your colon, goes through bacterial fermentation. Hizo gases zinakuja. So the gases is what causes bloatedness. Okay, so the gas causes bloatedness. So that's maybe a classical example of that. So they need to go for a diagnosis test to confirm if at all it is.
Yeah.
If it is, then we have a solution, lactose-free milk.
Okay.
Yeah.
Sawa sawa. And actually this lactose, Brookside Plus lactose-free milk can be taken by the whole family.
Yes.
Sasa mama, mtoto, iwe nani, everyone can enjoy it. So haina age limit. It is also good for the baby. Not literally ule baby wa mwenye hajaanza kuwin. Let me be clear on that. Yeah. Mtoto mchanga. If that helps. Uko na mafans hapa George. Hi KTN, I study with George, and what he has taught today has been exemplary good. Thanks for the show. Na ametumia mara kama 5. So ajawacha jina sadly, but yeah, you're doing a good job.
Fan base.
A fan base. Na pia ananiambia tena, he actually studies with my cousin as well. Napokea salamu Tiffany. So but on nutrition mko wengi. And also before the break we were talking about what you actually do.
Yes.
Umesema ni Kenya
Nutrition and Dietetics Students Association.
Okay.
Yeah.
So it's what do you do as students?
So in abbreviation we call it KENSA.
Yes.
Kenya Nutrition and Dietetics Association. So I founded it in September 2023.
Okay.
So the main aim of the association was to bring students who are studying nutrition and dietetics together. And we are about in 83 institutions across the country. So we bring them together and we are able to deliberate, learn from each other, promote optimal health, advocate for health, be able to, what you learn in class, take it out to the communities and do public campaigns like now what you're doing here. So we do it out there. Okay. So we've been able, and this is something that it's been done for the first time, the nutrition fraternity. It never existed. So for the first time we were able to bring the students together. We do scientific conferences, seminars, like last week we had one in Egerton University. Good attendance, 1,000 students coming through. Yeah, so it's a good thing. It's helped us to advocate for better nutrition.
Yeah. And especially for Brookside, what do you feel it is, how valuable is it creating this awareness, especially as a nutritionist?
It's very valuable because remember, this information is not available to the public. Most people suffer in silence. Okay. They have this condition, but they suffer in silence. So having, giving us this platform to be able to educate the public, it's very good because then people will be informed and know what to do and even seek early diagnosis.
Okay.
Yeah.
Thank you so much. There's one asking very quickly. I have 1 minute left. Hello, KTN, watching from Nairobi West. Can I have lactose-free milk when I am diabetic?
Yes, you can.
You can?
Yeah.
Okay.
Yes, you can.
Ni kama huyu ndio nitampatia hata hiyo.
Yes, you can.
Anaweza?
Yes.
Okay, that is fine. So please write your name, your number, where you're from when reaching out to us so that we can know where exactly we are taking these deliveries. So the one who asked about being diabetic, I'll give you one hamper. And as we're finishing, hi Zaitun, I use lactose-free milk to make smoothies and tea. Since I get gas when I use the regular milk, I appreciate Brookside for those products. Kindly give me a hamper as your die-hard fan of the show. From Nairobi Feather. Huyo ndo mwingine nimechagua. Sinimpate? Aya, wamesema tick. Aya, please text in your name, your number and your location. Tuendelee tutengeneza. Ukitengeneza smoothie next Sunday niko hapa nitumanie. nitumanie nikikunywa hapo lactose free Brookside Plus lactose free smoothie. Thank you so much, George. Thank you for the knowledge, the insights today. Honestly, I have learned a lot. I can say this was a well thought out topic, especially to Brookside. Thank you so much also for this campaign, the Brookside Plus products, probiotic yogurt, and also now the lactose free milk. Asanteni sana. Haya, wacha tuachie Space News ingia. Asante sana. Until next Sunday, see you guys. Find this episode on YouTube. Tuonane at KTN.